Everybody, welcome. It's so wonderful to have you here for this webinar. The COVID-19 pandemic, can voice first technology help? Well, this is obviously a critical thing, and I'm so pleased that we are all here to talk about this. Welcome. My name's Teri Fisher. I am the founder, the creator of Voice First Health, and Voice First Health is a podcast. It's a resource where really anything that has to do with the intersection of voice technology and healthcare, I'm trying to bring that to all of you and to try to push this industry forward, because I think it is so important. And so much of what we're going to talk about today really is a moment for voice technologies to really shine and to really help us with what's going on. Having said that, I want to share with you a short little video just to start us off, and then we're going to get into the program. And, seeing that we are all distributed really across the world, and we're all sitting in front of our computers, some of us with webcams, with microphones, and yet here we are as a community. I came across this video just last week, and I thought, wow, this would be a really cool way to start off this webinar, because it takes a lot of those concepts, community, and yet being isolated to a certain degree in a physical sense, and bring it together and to really strengthen what we're all here for. So let me share this with you and enjoy this short little video here. I heard that and it sent chills down my spine, and hopefully most of you could hear that. I know there were a couple of issues there, but boy, when I saw that and I started thinking about, here we are spread out around the world, but being able to use our voices and talking about voice technology and healthcare, I just thought that was just so powerful. So as I said, my name is Teri Fisher. I am a physician here in Vancouver, BC, Canada. I'm a family physician, sports medicine physician, and I run Voice First Health, which is the podcast all about the intersection of voice technology and healthcare. What I want to do is I'm going to start off the program here and just dive into a little bit of an overview of just some of the thoughts that I've been having over the last couple of weeks and months about how voice technology can help us. And then we've got a really fantastic lineup of guests. I'm so appreciative of all the people that are donating their time to be on this webinar, this little mini conference, if you will. So we'll get to all of those people. I want to jump into some of my slides, and here we go. In thinking about that last video that we just saw, and thinking about voice, what's very clear, and I don't know if you caught that at the beginning, is they said that one voice makes a difference. But I thought about this, and I realized that when we have many voices make a roar. And when you think about what we're talking about now, we're talking about a pandemic. When we think back almost exactly 100 years ago, 1918, 1919, with the flu pandemic. After that, what came out of that pandemic was the 20s. And anybody know what the 20s were referred to back in the 1920s? The 1920s were referred to as the Roaring 20s. And this is such an opportunity right now, because I don't know if it's ironic, if it's spooky, what it is, but we're entering the Roaring 20s. And these Roaring 20s, the 2020s, are going to be the decade of voice. This is where voice is going to have a tremendous impact. And when we get through this pandemic, I hope that we will all be part of, pushing this industry forward. So, having said that, I want to talk about, like I said, can voice technology help us during pandemics? Now, I gave a TEDx talk almost about a year ago, and it's crazy to think about how this was foreshadowing. I want to play you just the very small start of my TEDx talk. When I play you this little clip of the TEDx talk, I want you to think about, what are the implications of what is happening today? Of what I'm just going to describe in this little minute segment is obviously not pleasant, but there's also some things that are very, some practices that I described that quite frankly should not be done today because of the social distancing. So I'm going to play this for you and just give you a little sense of what this is all about. And again, put this in the place of what's happening today. Have you ever woken up and felt like something was off? Maybe you had a scratchy throat, or you felt like you were shivering, and you had these thoughts, something is not quite right here. So thoughts start racing through your head. I'm going to have to look after my kids. I'm going to have to call into work. I'm going to have to go see my doctor. And so you make an appointment, and you climb into your car, bundled up, drive to your physician, go into the office, wait in the waiting room, eventually get seen. Doctor talks to you, examines you, says you need some antibiotics. So you bundle up again, get back into your car, drive to the pharmacy, talk to the pharmacist, wait while you get your medication prepared for you, climb back into your car again, go home, climb into bed. It's a big ordeal. But what if it didn't have to be that way? What if you could get the medical care that you needed from the comfort of your own home? We're about to witness something quite profound. We're going to see a radical transformation in the entire way that we experience the healthcare journey. And it all comes down to something that we use on a daily basis, something that we all have with us right now, something that we are born with, and something that I'm using at this very moment, our voices. Right, what I've described there is something that hopefully you're not experiencing it personally, but many of us are experiencing, in that we're waking up, we're not feeling well, and we're not sure what to do. So some of the realities that we're facing today, this is what we're going to go through in the next probably 10 minutes or so, 10, 15 minutes. Some of the realities of this pandemic, what I see potentially could be the voice impact, and some of the next steps. The realities. High infection rate, okay? We all know that. We all see the graphs, those scary looking graphs at how the infection rate is doubling every, depending on the stats that you read, 3-4 days. And the fact is that this is a very infectious illness. Misinformation, which we'll talk about. There's a lot of good information out there. There's a lot of misinformation out there. There are people that are trying to help each other, and there are people that are taking advantage of the situation and putting out things and promoting the fear. And so one of the issues is, how do we get the good information that is going to help people to really take the best care of themselves and their loved ones in this time? Privacy security regulations. This one's quite interesting to me as well, because if we're going to count on technology, there are a lot of regulations in place that will limit what we can do. Is that a barrier? And that's a question for you. Well, I think it is. The reality, social distancing. Well, we all are experiencing that right now. And how can we use voice technology to help us with what we are supposed to be doing today? And we'll get to that. Lack of resources. We're hearing about this too. Lack of masks, lack of personal protective equipment, lack of equipment, ventilators, and so on. So this is a real problem. And of course, with the way that the infection rate is going, that is one of the big issues. And that's why we are talking about flattening this infection rate curve. And not enough providers. And I'll get to that as well. So there are a lot of issues. And the question, of course, is, can voice technology help us with these? Well, I think to set the level playing field here, and somebody asked, what do I mean by voice technology? Well, I know there are some people on here that are very familiar with voice technology, and some people are not. So I want to take just a quick moment to, like I say, level the playing field here. Voice technology. When I talk about voice first technology, I'm talking about interacting with a computer using your voice first, not only, but first, using your voice to interact with a computer and having that interaction. And this is something that I've been giving a lot of thought to as well. And I actually believe that voice is the next operating system. It's already becoming the, quote, next operating system. Why is that? Well, there's a number of reasons. First one, versatile. Voice is extremely versatile, meaning you could be doing something else while you're speaking. You could be driving your car. You could be working out. You could be bathing your kids. You could be cooking, but you can still be using your voice. It's very hard to be texting, typing, swiping, clicking, whatever, when you're doing some of those activities. In fact, it can be dangerous. So that's one of the features of voice. Voice allows us to multitask. We can do almost anything at the same time as speaking and listening. Voice is omnipresent. Just like this picture of these trees surrounding you. Sound surrounds you, unless you're only listening to a video in mono in your left ear. In that case, it's only on your left side. But other than that, voice surrounds you. So I could hear somebody in the back behind me say my name, and I would be aware of it. Okay. So omnipresent. Voice is always on and available. It completely envelopes us with the sound of the spoken word. It's innate, right? The first thing that a baby does when a baby is born is it cries. It uses its voice to call out. This is something that you don't have to learn. We have to learn how to communicate through any other means. Texting, typing, reading, writing, swiping, all that stuff is all learned skills. But voice is innate. So voice is instinctual. It's the most natural way that we know how to communicate with each other. It's contextual. We can hear emotion in voice. We can potentially hear disease states in voice, and you're going to hear about that later on. So, for example, if you were to write an email to someone and you've got or you're receiving an email from someone, you don't know necessarily the emotion behind that, if someone's being sarcastic or if someone's trying to be funny. But with voice, you can hear that. You can hear that in the inflection. And that's something very unique about voice. So it's contextual. Voice is expressive. Variations in the way we speak are situational and can reflect emotional or physical states. And it's efficient. It is extremely efficient. The way that we talk in terms of the speed, the average typing speed is about 40 words per minute. The average speaking speed is about 150 words per minute, or about 3 to 4 times faster. So voice saves us time. It is the most time-effective way that we know how to articulate our thoughts. VOICE, versatile, omnipresent, innate, contextual, and efficient. Which leads me to the voice impact on some of these issues that we've talked about. So high infection rates. What if we have, and this is already happening, and you're going to hear about this from some other people as well. I know Brett's going to be speaking a little bit about this coming up. But what if we could have voice-enabled devices? One of the biggest ways, of course, that we are transmitting not only coronavirus, but other illnesses is through contacting something that has the virus on it. So you think about elevators, you think about checkout machines, you think about kiosks and all the things that we're touching and punching numbers into or selecting things. The whole point of those devices is to process people quickly. But what if they're voice enabled and you don't have to talk, you don't have to touch them anymore. You can just talk to them. Trusted information at home. Voice devices have the ability to do this. However, there are some problems with this, and we're going to hear about this as well a little bit later on. For example, Amazon, Google, the major companies are pulling third-party applications because they don't know if they are trusted information. I can tell you personally, as a physician, I created what I would consider to be a trusted source of information, an evidence-based source of information with a skill and a flash briefing. It was pulled. Is there a potential for voice technology to help us with this? Absolutely. But what is the right way to go about doing this? And we're going to hear from John Stein and the Open Voice Network as well on his thoughts on this and trust. What about allowing for personal health information through a voice assistant? What's very interesting, and some of you may have heard this, is that already some of the regulations in the United States are being relaxed a little bit so that physicians can use things like FaceTime, which is not necessarily HIPAA compliant, or other types of video teleconferencing platforms to talk to their patients. I actually think this is a very interesting turning point for healthcare in general, because I think this could extend into voice. Can I drill down on that a little bit more? What I mean by this is, what I hope will happen is that we will able to be or it will be easier for people to share personal health information through a device. Now, that is going to require some changes in the legislation. But if you ask patients now, do they appreciate being able to talk to their doctor through a potentially not secure, not HIPAA compliant platform? By and large, they say yes. So do the patients want it? It seems that they do. I know from personal experience, my patients, we've gone to virtual teleconferencing and to phone calls. Phone calls are a little different, but teleconferencing, they love, love, love this. All right. We're talking about social distancing, and I challenge us to think of this slightly different. What we actually are trying to do here is physical distance ourselves, physically distance ourselves, physical distancing, but we want to be socially connected now. And so I think a better term is actually physical distancing and social connecting. What we're doing right now is connecting socially through this platform. And it allows us to have a sense of community. It allows us to not feel so isolated. And how can voice technology do that? There's lots of ways that voice technology can help us. And we're going to hear from Roger Kibbe as well. He's going to talk about some of the different applications that you can use the voice to help with loneliness, with isolation, with the mental health issues that can go along with that. Diagnostic algorithms at home. As you'll hear, I'm going to play out one more final clip here of that TEDx talk. One of the things that's very interesting is being able to use the voice technology to start to take a medical history. And we've already seen this with Siri, asking you about your symptoms and directing you to the right resource. Voice technology is so well suited for this because it is so frictionless. This is just one example from my jurisdiction, British Columbia. There's a phone line that's been operating. It's a free phone line. People can call in and get some information. They are inundated, obviously, right now with calls about symptoms for COVID. What if they put this on a voice assistant, and the voice assistant was in each person's home, or as many, it's a cheap device. The more people, maybe it's even cost effective to give each person a cheap dot and have them talk to the voice assistant. Imagine the amount of pressure that this will take off those systems. Voice-based testing at home. So you're already hearing about this too, right? Partnerships with Bill Gates and Amazon sending test kits to homes to test for COVID. And what if it had a voice interface so that it just talked you through how to do it? That would be really interesting because you wouldn't have to learn anything. You literally say to the device, whatever the command is, I've got this test kit, what do I do? And it just tells you how to do it. Vocal biomarkers, so actually detecting disease from the sound of your voice. This is fascinating. And we've got two speakers coming up who are going to speak more about this. I don't want to get into this right now, but the idea is, can you actually detect the virus just by having a smart speaker listen to you speak? And then voice can help with treatment. So it can guide you through the treatment. The treatment really for COVID is supportive care. There's no cure. It's managing the symptoms the best as we can. And so what if a voice assistant could ask you about what symptoms you're having and actually provide some suggestions about what you should be doing based on those symptoms? So voice can actually be a healthcare provider. Imagine if the voice assistant itself was acting as the triage nurse, and it could assess the urgency, it could direct the resources, and in effect, it is actually having an effect on our whole entire population, but at an individual level. This part is really, really exciting. So next steps. I want to play you the last minute now of that TEDx talk. And I want you to think about this again in the context of COVID. Now, when I gave this example in the TEDx talk a year ago, I was thinking in terms of strep throat, but I could very well, it's kind of eerie that this kind of scenario is what I was talking about, but just with a different disease. So here we go. Let's do this again. So again, I asked you the question, have you ever woken up in the morning and felt like something was off? That scratchy throat. But before those thoughts start running through your head, your voice assistant or smart speaker says, "Good morning, how are you doing?" And you say, I'm not feeling so well. And already the assistant is running an analysis of your voice. It's listening to you cough. And it's already has some ideas of what could be the problem. So it says to you, "I'm sorry to hear that. Do you mind if I help?" And you say, "Of course." So it starts to ask you questions similar to a doctor. Do you have a sore throat? Do you have a runny nose? And other questions. You answer those questions and it says, "You know what? I think you have strep throat. We need to do a strep test. Would it be okay if I had one delivered to your home right now?" And you go, "Sure." Shortly thereafter, however it gets delivered, maybe it's by a drone, it gets delivered to your home, and the assistant talks you through how to use it. This is how you do the test. Let's analyze the results. And yes, it looks like you do have strep throat. So now we need to get you some antibiotics. Don't worry, I already know what you're allergic to because I know some of your medical history. So if it's okay with you, I'm going to send you the appropriate antibiotic to your home. Fantastic. And while I'm at it, you can't go into work today, so I'll make the phone call for you into work. Great. So the antibiotic arrives again, you take it, the device monitors your recovery, tells you when to take each dose, and alerts you to any potential complications that would be an indication for you to go see your doctor. Physical distancing, social connecting. I don't want to belabor this anymore. These are the next steps. I want to get Brett on here because Brett's up next. Physical distancing, social connecting. This is the main thing that we need to focus on right now. This, I believe, the pandemic is a catalyst for change. We need to stay informed, use our voices collectively to push this forward. I think there's such an opportunity here for voice. So remember, one voice makes a difference. Many make a roar. And together, I think we can make that roar for the roaring 20s. These are some of the resources that I have. Health Tips is my flash briefing. This is a general health tips flash briefing. However, given the scenarios that we are in right now, I am transitioning to a little bit more of the coronavirus tips on there. This is the podcast, and this is a book that was just published. Myself and co-authors, Harry Pappas, David Metcalf, and Sandhya Pruthi. We just published. This is the first book on voice technology in healthcare. And thank you very much. I'll give a link to that afterwards.